Folks, it's time once again to gather around that fireplace and enjoy a nice little chat about your pet's health and well-being. Once again, here's Dr. Bryan Langlois of the Pet Pantry of Lancaster County and the Pennsylvania Veterinary Medical Association to talk with us all today about the importance of heartworm and its prevention in your pet.
Hello again, everybody, folks. This is Dr. Bryan Langlois of the Pennsylvania Veterinary Medical Association, here again by the fireside for another chat about your pet's health. And today we're going to kind of talk a little bit about what, we sort of consider the scourge of the circulatory system when it comes to most animals, and that is heartworm. The weather, like I said, has finally been warming up, and that means mosquitoes are starting to come out. Everybody's probably seen them at this point and be bitten, and it's really important that we talk about exactly kind of what heartworm is, first of all, some of the problems it can cause, and then most importantly, why it is so important to have that preventative done and treatment for heartworm if it were to occur. So the first thing, kind of really, what is heartworm? Heartworm obviously is a worm, and it is a worm that kind of floats through the circulatory system in multiple stages. And basically, to kind of take you back a little bit, when you have two adult worms, obviously they produce little tiny worms, and these are called larvae, or sometimes they're called microfilariae. And these little worms will float around in the circulatory system and actually be taken up by a mosquito during a blood meal. Now, while inside the mosquito, actually, these tiny little baby worms or larvae actually, what we call molt or change form and size through a couple of stages, and eventually they become a certain stage of a larval form that then can actually be injected back into a dog or a cat when the mosquito takes another blood meal. And it is these more formed adults that then kind of swim around the bloodstream, find their way to the pulmonary vessels, or the main vessels that leave the heart and go out to the lungs, and will kind of set up shop there. From there, they will become adult worms, and the cycle kind of starts again. We're going to show you in a couple of seconds just a quick little diagram that kind of demonstrates exactly the entire life cycle of the heartworm parasite. As I said, heartworm can affect dogs and cats. Does not really affect people, so there's really no concern there. But even if your animal is completely indoors, such as indoor cats, some people actually keep their dogs indoors all the time, does not mean that your pet cannot be infected with heartworm. That's very important to realize. Mosquitoes do not just stay outdoors. They can very easily come inside, and it's important to make sure that you practice proper heartworm prevention with your pet, and we'll talk about what that is in a little bit. So what we're going to do right now real quick is just show a quick graphic showing the life cycle of the heartworm parasite in a way that's probably a little bit easier to understand, so you can figure out exactly why we're targeting certain things when we do as far as treatment. So basically, we'll take a look at that right now, and we'll be right back.
All right, so here we see kind of a very easy broken down chart that shows the life cycle. If you look at the Cocker Spaniel and follow everything clockwise, you'll see that obviously that Spaniel is infected. Microfilariae are taken up by the mosquito, where they kind of transform into more infective stage larvae. They then bite the golden retriever. Some of those larvae are injected in, and basically then they go on to become adults and infect the heart.
Hopefully that's given everybody just a general overview of the life cycle of the parasite. It's very important to understand from a general standpoint, because when we talk a little bit about, first of all, testing for heartworm as well as treating heartworm or using the heartworm preventative, we want people to understand exactly what we're doing in each of those stages, so everybody has a general understanding of what's going on. So the next question that comes up is, why should I be concerned? Why is it a major issue in my animal or my pet? And it can be. I have seen instances where the reaction or the damage done by these worms has been so severe that the animal unfortunately has died or had to have been euthanized because of this infection. So it is very, very severe. It's something to take very, very seriously. We look at various kind of stages of infection from mild to severe, and that's going to kind of dictate as to what kind of clinical signs or symptoms you may see in your dog or cat. In very mild infections where the body really hasn't reacted to them in any way, or there may be a very low worm burden, you probably won't see anything. And this is exactly why we stress the importance of testing your animal every year for heartworm, even if they're on the preventative year-round, because we catch probably a majority of the infections, especially up in the northern areas of the country, on these tests. The owner has absolutely no idea that their pet is infected. You know, it's just something that's routinely tested for yearly, and we want to make sure that people understand that's why it's so important, because if we catch it early, it's much easier to treat and there aren't really any side effects. As you get into a little bit more of a moderate infection where the animal maybe has been infected for a period of time, you start to see some changes that may be going on secondary to the lungs and the heart. And this just may be a little bit of coughing. That's usually one of the first signs that we see. And this is because the worms, even though they're termed heartworm, it's a bit of a misnomer in most cases, because the adult worms actually will reside down in the vessel, what we call the caudal pulmonary vessels to start, which are the vessels that kind of come from the heart and go down to the lungs. And so you'll get a lot more lung type reactions where your vet may hear some abnormal lung sounds, or like I said, coughing will be going on. That's usually the first irritation signs that we see from it. As the animal becomes more infected, so there's a really, really heavy worm burden, or the animal's having a really severe reaction, you can see more severe signs such as difficulty breathing, exercise intolerance. They don't seem to be able to withstand the same amount of exercise. Going for a walk, they get tired much more easily, or really start to panic and seem to have trouble breathing. Things of that nature. In certain cases of very, very high worm burdens, the worms actually kind of migrate back up through the heart. And if you think about it, again, the heart is a 4-chambered structure. You have the 2 atrium on top, you have the ventricles on the bottom. In between those chambers are what we call valves that ensure that the blood is flowing properly both to the lungs and then to the rest of the body. And those worms can actually get inside and interfere with the proper closing of those valves. This puts extra strain on the heart to pump blood normally to keep everybody, both ourselves and your pets, body perfused with blood properly, keeping their blood pressure up, making sure oxygen is reaching all of the cells in their body and the waste products are being removed. So naturally you can tell that these types of worms getting in and interfering with that is going to make the heart have to work that much harder. When the heart has to work that much harder, eventually it's going to weaken slightly if it's put under that stress for a long period of time. So it may try to enlarge a little bit to make up for it, but all of these changes prevent the heart from being able to pump effectively. And over time, this is going to lead to what we call heart disease or congestive heart failure, where fluid will start to back up in certain areas because the heart cannot pump blood normally and effectively. And the 2 areas that we see this most commonly are in the lungs and in the abdomen. So you may notice, again, some coughing or some weird sounds from the chest, as well as perhaps some fluid buildup in the abdomen as far as that goes. That's the most severe case. And I'm actually going to show a video in a second of probably the most severe case of heartworm that I personally have ever seen. It's a video that somebody showed me. It was not a case of mine. But in the most severe cases of these infections, you get a condition where there has to be an emergency surgery done to actually remove the worms from the heart area. And these worms had actually become so overburdened in the heart that they actually started working their way up what we call the vena cava, or the main vein that feeds the heart with blood to reoxygenate through the lungs. And it's a very dramatic video to kind of show what severe infestations can do, as well as what these worms look like. Most of the time we don't see them, except unfortunately on a necropsy or a post-mortem if the animal succumbs to them, because we do have treatments that will take care of it. So if you notice any of those signs in your animal, it's really important to have them checked fairly soon. Make an appointment with your vet, talk to your vet about it. They'll probably want to run a very, very simple blood test. And what this blood test does is it actually checks for what we call antigens, or little protein parts that are unique to the adult worms. And many of you have heard of the SNAP test. We talked a little bit about in a previous Fireside Chat about the SNAP test for Lyme disease. And oftentimes these tests are combined into one test, so you're kind of getting more bang for your buck as far as being testing for things like Lyme disease. You're also testing for presence of heartworm. If that test comes back positive, it's an indication that adult worms are present in the body. What will be done next usually is more blood will be sent out to a lab to just confirm the result, because we want to make sure we're definitely right here, as well as another test looking for what we call microfilariae. And these are those little baby larvae, like I said, that adults will produce. And if they are present, that's a sign that reproduction is going on, and your dog, through another mosquito, could potentially infect other animals. Sometimes we see microfilariae, sometimes we don't, but it's important, again, for your vet to know that. The next thing that will be done is probably some chest radiographs. And what these chest radiographs or x-rays will do is they'll look at the shape of the heart and look at the lungs to make sure there's no any kind of what we call pathology or changes in the lungs or the heart that would give us higher cause for concern. Once all of that is done and we've done what we've called staging the infection, then treatment can begin, and we'll talk about treatment in just a little bit. But what I want to do first is just show everybody that video real quick. It's a minute or two cut down, just what these worms look like and what happens in these severe cases, and why it is so important to make sure your animal's on preventative to prevent, obviously, your animal ever having to undergo this type of procedure. So we'll check out that video and we'll be back in a bit.
So here what we see are worms actually being pulled out with an instrument from the jugular vein itself. This instrument is passed down the jugular to closer to the larger veins, the vena cava, and you can actually see, as the veterinarian in this video starts doing, just the magnitude and the number of worms that can really become a problem in these guys if you get to a situation where you get, a major infection. And all of this can be very easily prevented, as we'll talk about in a second, with monthly heartworm prevention. There's no real reason why things should get to this stage, but I wanted people to see how absolutely severe this infection can be, how many worms can actually get in and infect the circulatory system. So, as you just watch this, it's kind of amazing and awe-inspiring how many worms can actually infect animals' hearts.
So hopefully that was a representation of the most severe types of infections that we see very rarely, fortunately. But if your pet was infected to that severe degree, that dog was in a critical state where basically we had to go in, or I should say the vets in the video had to go in, remove those worms because that dog was in imminent threat really of cardiac arrest or complete heart failure because of the severe worm burden. So the big thing we talk about next is, okay, my animal is infected with heartworm, what do we do? Well, basically your vet, as we explained, is going to test for it with a simple blood test. They're going to send out confirmatory blood to a lab if they come back positive on that in-house or in-hospital test, just to make sure that the test was right, because we don't want to treat something that's not there, as well as to see if there is evidence of those microfilariae or little baby larvae floating around in the bloodstream of your dog. After all of that is confirmed and they've staged out the infection, as we talked about previously, the next thing that's going to happen is a treatment protocol is going to be developed by your vet, and every case is a little different, so your vet's going to look at each case individually. But normally what's involved in it is an injection of a medication deep into their muscle that will kill off the adult worms. In addition to that, your vet may put them on oral preventative medication, normally the monthly stuff that we give, but on a more condensed schedule. So potentially even every day for a couple of weeks to start, just to make sure we kill off any of those larval stages that may still be floating around. It's important to realize that your dog or cat will probably have to be kept in the vet hospital for a few days, or at least a day during the treatment protocol. And that is because as these adult worms die off, we want to make sure that there's no major reaction to the body, either via an allergic reaction, or sometimes a little piece of an adult worm as they die can break off and kind of shower off into the vessels in the lung, and that can cause a severe emergency situation as well. And the vet hospital, obviously, that's the best place for them. They can catch it really quickly and try to treat any kind of reaction that occurs. So you'll have to talk with your vet exactly about how your individual animal will be treated, but it's usually a series of injections, 2 or 3, again, depending on the protocol that's used, and they're usually spaced out over about a month or 2 months, again, depending on the protocol. You can talk with your vet about that. The big thing everybody worries about more importantly, though, is prevention. And prevention, obviously, is the key. We don't want to get to the point where we have to treat these animals. We want to make sure that they're prevented from ever getting infected in the first place, and that severely. Prevention, as everybody knows, is usually in one of 2 forms. It's in a monthly tablet or chew that you can get from your vet, or in some of the topical medications that are out there now. Revolution is the most common one that comes to mind, that you just put on the skin. It takes care of fleas and ticks, things like that, but also will help prevent heartworm. And when we say preventative, basically what we're trying to do is prevent those kind of molted larval stages that then are injected back into the dog when the mosquito feeds again, from developing into adult worms. This is what we're preventing when we give heartworm prevention. And that's why it's very important that your animal gets on that preventative and stays on that preventative every month, year round. It used to be, back in the olden days when we had winters, that things would get so cold that there would be a mosquito die-off. The risk of infection really wasn't there. So we said, oh, so from like November to maybe March, you didn't have to worry about doing the monthly prevention. That's not the case anymore. It's really important that they stay on the prevention year-round, every month. We just don't have the cold enough winters to ensure a really good die-off of mosquitoes. And again, mosquitoes don't stop at the door of your home just because it's your home. If they can find a way in, they're going to. And they potentially still can infect during those stages, so that's really important. We usually do recommend, even if they're on prevention every month, testing them once a year anyway, because there have been cases of product failure. Not many, it's a very, very low percentage, probably less than 1% when you really calculate it out. But that's important to know, because if you have been on there and unfortunately your animal is infected and they've been on the heartworm preventative, the company that produces the heartworm preventative will often cover the cost of treatment, which is obviously a bonus to your wallet, so you don't have to take those kind of things and worry about them. There really isn't much more to say about prevention, basically, except it is really, really important, and that's why we stress the preventative aspect so much. You've seen how severe these infections can get. We've shown you the kind of damage that can be done. Prevention is the key, and these preventatives work very, very well. There are very few side effects. The one thing that I will mention to everybody about the preventatives is you want to talk to your vet if you happen to have a collie, anything that's bred potentially with a collie-type mix. These dogs, Shelties, fall into that category a little bit too, some of the other herding dogs, because there is a genetic kind of mutation that has gone on in these dogs that sometimes can make the active ingredients in these heartworm preventatives, which is usually a drug called ivermectin, it can cause some toxicity to their nervous system. So there are other drugs out there that can be given. You can talk to your vet about that, but please make sure that you talk to your vet if your dog is one of these mixed breeds with collie, purebred collie, Sheltie, things like that. That's a very important safety tip, just to make sure that you are giving them a preventative that's not going to cause side effects down the line. So again, that's pretty much wraps it up for this fireside chat. Hope everybody has learned a little bit about heartworm. Again, with the season starting to change and things getting warmer, it's going to be more of a problem. Make sure that you see your vet for a yearly appointment for that yearly heartworm test and to pick up your preventative. Your vet is the best place to get that preventative. I know there are places you can get it online and over the counter nowadays, but really your vet is the best source for these pharmaceuticals and these drugs, because they can ensure that they have been stored properly, they've been shipped properly, and they can also make sure that you're getting the right preventative for your animal. If you just send off to an online pharmacy, you certainly can pick one that's out there, but you may not know if it's exactly the best for your dog or cat. Your vet can definitely tell you that stuff. So until next time, this is Dr. Bryan Langlois of the Pennsylvania Veterinary Medical Association. Again, reminding you, as always, take your pet to the vet, not the net. And we'll see you around the fireside for our next chat.
For more information, be sure to check out these websites that'll give you a little bit more info. Or even better yet, make an appointment with your vet. Make sure your animal is checked yearly for heartworm and that you definitely stop by your vet to get heartworm prevention on a year-round basis.